all, this is Dr. Shilpi Reddy, and today we are going to talk about irregular periods. That means irregular menstrual cycles. For this concept to be very clear, you should understand what are normal periods. When your period length is somewhere between 21 to 35 days, they're coming on a regular basis, and you have a normal flow of 4 to 7 days without having a lot of clots and heavy bleeding, then if the pattern is quite regular, then it is called normal periods. But if there is increased flow or increased cycle length or decreased cycle length or decreased flow, then it comes under irregular periods. Why do we have irregular periods is the topic that we're going to discuss. Irregular periods can be absence of periods for more than 3 months, decreased blood flow, which is called oligomenorrhea, absence of periods is called amenorrhea, heavy period bleeding and heavy pain is called as dysmenorrhea, increased bleeding is called as menorrhagia, and abnormal bleeding, whether it is little spotting, which is called less bleeding, and more bleeding in the form of clots, everything comes under the spectrum of irregular periods. Now, there are several reasons for irregular periods, and we need to understand that there can be so many gynecological and obstetric conditions that can lead to irregular periods. Some of them we're going to discuss in detail today. The most common causes of irregular periods can be polycystic ovaries, wherein egg formation and egg release is not happening on a regular basis. In such conditions, there are high level of androgens, and there is very low level of progesterone, and there is a dominating factor of estrogen that is happening. Since there is no egg formation and release, likelihood of progesterone being very less is there, and insulin resistance is also there. So there can be irregular bleeding happening. Sometimes months together they don't have bleeding because there is no egg formation. Another reason for irregular periods is endometriosis, where the lining of the uterus, which is supposed to shed every month outside, is present in the ovaries and in the tubes or anywhere outside. That can cause irregular periods, pain during periods, and severe pain at times. And there can be infections also as one of the major reasons for irregular periods, which can cause heavy periods and painful periods also. Some conditions wherein the egg count goes down, whether it is premature ovarian failure or something related to chemotherapy, radiotherapy, or any autoimmune conditions, the egg count decreases, and that can again lead to no periods or less periods and absence of periods. And there are hormonal problems, like thyroid hormone issues, whether it is hyperthyroid or hypothyroid, it can disturb your cycles. It can be prolactin, increased prolactin levels can give lesser bleeding and infrequent periods and delayed periods. In a similar way, there are other hormonal issues, like it can be some cortisol hormone problems and central brain hormones that get disturbed at times and can cause irregular periods and no periods. And there are some bleeding disorders wherein like thalassemias or clotting disorders wherein there is increased amount of cycle length and increased amount of bleeding because of clotting mechanism disturbances. And there are several other reasons like uterine problems and ovarian tumors and cysts that can give irregular periods. And it can be fibroids, large fibroids opening into the cavity and causing overbleeding. In a similar way, there are several lifestyle factors also that can cause irregular periods. That can be stress. Sometimes when women or men have exams and they're going through stressful periods in their life, whether it is office stress or marital stress or any relationship stress, they can have irregular periods. In a similar way, if the weight gain is too much or weight loss is too much, you can have irregular periods. In several conditions of viral illnesses, whether it can be dengue, whether it can be COVID, we have seen cycle disturbances happening, and that can be because of the viral illnesses also. In a similar way, if your irregular intake of pills are there, if you are on anticoagulants and you've had a recent miscarriage, you can still have irregular periods. And there is another reason when you have ectopic pregnancy and you've had operations for ectopic pregnancy. Also, at times it gives irregular periods for some time. And you have certain conditions where you have had surgeries and you have some blockages and all these problems and uterine abnormalities where you can have irregular periods. Whether there is scarring of the uterus during the surgery or there is something that has gone wrong, then also you can have irregular periods. And for all these conditions, you should understand one point, that you should get an ultrasound done. Wherever necessaries, you should get a biopsy done, whether it is thickness of the lining of the uterus, the endometrial thickness is high, you should get a biopsy done. If your cervix is looking abnormal, you should get a pap smear and a cervical biopsy done. And wherever possible, if the lesions are identified like polyps causing irregular bleeding or endometriosis causing irregular bleeding and fibroids causing irregular bleeding, laparoscopy and hysteroscopy also have to be done. In conditions where you have cysts and certain abnormalities, again surgical interventions are also there along with medical management and treatment. Whatever said and done, irregular periods cause a lot of disturbances in women's health and women's bodies. You should be very vigilant and take care of it at the earliest so that you do not fall prey to other health problems and problems like anemia and infertility and other health issues in women. If you like my videos, do share and subscribe and follow me on my YouTube channel.